New research shows there could be a link between COVID and heart damage. According to the European Society of Cardiology, people who have recovered from COVID and are still experiencing shortness of breath during physical activity may be suffering from heart damage. The study surveyed more than 60 patients who had no history of heart or lung disease before being hospitalized with COVID. Scientists say more research is needed on the heart consequences of COVID. Dr. Salim Surani joins us live to discuss. Dr. Surani, good morning. Good to see you today. Thank you so much for being with us. Now, does this happen to everyone that gets COVID, or can it happen to someone without any heart disease?
Good morning, Barbara. Here. This is not something new. We started seeing this almost a year ago. We published some papers, I think, ourselves more than a year ago. We had several cases in which we start seeing some of the cardiac complications of the COVID. So that is not something new, but what we saw, like a lot of the patients were recovering, but we also saw a lot of patients having symptoms for maybe, 6 months, 1 year. And what they study in Brazil, what it does is it actually really look into it. Is there anything going on in the heart? And the best way we do is like the simplest way is we do the ultrasound of the heart. And they did on those patients. And what they found was almost 33% of those patients who actually had never had any cardiac issue, their heart was not performing well. In other words, what we look into is what's your heart rate and how much it pumps good and how much, the blood flow it pushes forward so that, body can get oxygen. So that was significantly affected in a lot of patients who did not have any cardiac history, no disease, and that was even seen about a year from the time when they got the infection.
And Dr. Surani, does COVID-19 do a further damage to the heart or brain for people who have been diagnosed with a heart disease or have had a stroke?
One of the things is with the long COVID, what we have seen, like some of the other illness, when you get the infection, you get better, you're done with that. With the COVID, what we have seen is a condition, what we call is the long COVID. It means that the infection has gone away. You initially get better, you get out of the hospital, but you never get back to your baseline. So what you have is a challenge that you can have a shortness of breath and the fatigue. So you have some of the heart issues, some of the neurological symptoms, some of the lung issues. So you can see the scarring in the lung. You can see a person complaining of fatigue and not feeling well. They have some weakness. Sometimes they have some of the sensory smell disturbances which can last for months. So we are still learning more and more about this condition. And what we are noticing that even when person who get the infection and they recover, they feel that they recover and they feel like they're not getting back to the normal because there are some structural issues which we see in those. And these are more in the people who have not been vaccinated.
Speaking of vaccinations, if you do have heart problems, is it safe to get the COVID-19 vaccine?
Well, if you had the infection in the past, we all know that the infection does not prevent the further infection as good as the vaccine does. So in the past, we have recommended 2 doses of the vaccines, and then, now we are recommending booster because we have realized with the newer variant, I think that can be a bigger challenge, and we need to have our antibody at very, very high level to protect against this variant because of different mutations which it has. So I think the best thing is even if you have infections and you're recovered from that, don't think so it's going to protect because we know that the reinfection is very common in people with the Omicron who already have the infection in the past. So the vaccination is our best defense at this time.
And Dr. Surani, thank you so much for being with us this morning. You will be joining us again the next hour, and we'll be talking about the latest on the Omicron variant. If you have a question for Dr. Surani, text your question to the number on your screen, 361-855-6397.